This is the fiercest janitor in the prison. Even the warden's face changes when talking about him. He even warned the newcomer Mary to stay away from him. It turns out that when the man just entered the prison, he did something incredibly crazy. His chest was slashed open, leaving a nearly 20-meter long wound. But he didn't care at all. Casually, he picked up a needle and thread to stitch up the wound, without even using anesthesia. Everyone was horrified by the scene, including the warden, and he is none other than the physician, Peter. On that day, a prisoner suddenly fell to the ground, struggling to breathe. Dr. Mary immediately brought a respirator to provide oxygen to the man. Strangely, the oxygen couldn't get through at all. Being a novice, Mary instantly panicked. Just as she was at a loss, a voice came from the crowd. Deep neck infection. Whose voice is it? The warden realized that this was a critical life situation, and immediately asked everyone to make way, although they were wary of him. At this moment, they couldn't care about that. He squeezed some disinfectant onto his hand, and gently touched it, quickly diagnosing the condition. It turned out that the patient's throat was punctured by a fishbone, and the wound became infected and swollen, due to consuming spoiled food. This led to the difficulty in breathing. Peter immediately took out the available equipment, and performed a puncture on the patient. After a series of procedures, a makeshift respirator was quickly assembled. The patient soon regained breathing, and everyone cheered. The young boy was among them, but he didn't know he was already seriously ill. Later, the boy met Peter in the corridor. Following the routine, Peter examined the boy's body. Unexpectedly, he discovered the boy's hands covered in a rash. The boy immediately explained that it was athlete's foot, and it would be fine in a few days. But Peter said, "In a few days, you will die." Peter suggested that he should go to a major hospital for a checkup. The boy reluctantly accepted the advice with a grimace, but he didn't take it seriously. He just went to the medical department to have his temperature measured, and seeing that there was no major issue, he went back to rest. However, in the evening, the boy suddenly started convulsing and developed a rash on his hands. When the emergency personnel arrived, they realized that the boy's life was in immediate danger. They immediately rushed him to the hospital for treatment, but Peter stopped them, saying that only Mary could save the boy now. They had to find her first before proceeding. The prison guards had no choice but to call Mary back, who was about to go on a business trip. Mary quickly arrived, but Peter only asked her to accompany the boy to the hospital. Although Mary was unclear about the situation, she still went to the hospital and followed Peter's instructions to have the doctors examine the boy's kidneys first. However, the doctors didn't believe in the judgment of a newcomer and only conducted a routine examination on the boy. When they saw the examination results, they indeed found something wrong. They hurriedly asked Mary for the diagnosis of the disease, but Mary didn't know either. At that moment, Peter called on the phone and requested the doctors to immediately perform a kidney biopsy on the boy. He suspected that the boy might have Fabry's disease, which has a probability of occurrence of only 1 in 10,000,000. Upon hearing this disease name, the doctors didn't believe that someone could diagnose it just by visual observation. But with Mary's strong arguments, the doctors finally agreed to perform a kidney biopsy on the boy. Peter, upon hearing the news, also felt relieved. It turned out that he wanted to use Mary's identity to convince the doctors. If the prison guards had told the doctors that the patient had Fabry's disease, they would certainly not believe it, and the boy would lose his life through various examinations. Now, Mary's next task was to find the medication for Fabry's disease. If they waited for the boy to be officially diagnosed before obtaining the medication, it would take at least a week. The most effective solution at the moment was to borrow the medication from another secondary hospital. After a night of hard work, Mary finally found the treatment medication. However, the next day's examination report showed that the boy did not have Fabry's disease. Mary thought that Peter had made a mistake, but at that moment, the boy started having hallucinations, slowly walking towards the rooftop. On the rooftop of the hospital, a patient walks on the edge of danger. One wrong move and he could fall, but he doesn't have suicidal thoughts. It's the result of intense hallucinations caused by his illness. Soon, he reaches the edge of the rooftop, slowly spreading his arms, preparing to embrace his deceased mother. In this critical moment, the doctor arrives in time, rushing behind the boy, holding onto him tightly, successfully pulling him back from the rooftop. Later, Mary concludes that the boy has Fabry's disease. She hopes the doctors can perform one more enzyme test to confirm the diagnosis. However, the doctors firmly refuse, because yesterday's examination results didn't show the expected abnormalities in the striatum. Then they promptly expel Mary from the ward. At that moment, she learns from the patient's father that the boy's mother and sister both passed away due to this strange illness, without ever having a diagnosis. Mary immediately rushes back to the ward and tells the doctors that this is a hereditary disease. If the mother had Fabry's disease, there is a 50% chance of inheritance for the children. With an early diagnosis in the medical records, the patient can be completely cured. So, Mary pleads with the doctors once again, hoping that they can perform one more enzyme test, but the doctors show a lack of concern, as the guardian has already requested a transfer, and they no longer feel responsible for the case. Meanwhile, Peter in the prison cannot sit still upon hearing the news. If they transfer now, all the tests will have to start over, but the boy's condition can't wait any longer. Peter looks at the clock, and he thinks of a solution. He asks the warden to tell Mary to bring the treatment medication to the ward. Mary immediately understands his intention. She quickly finds the doctors, hoping to transfer the treatment medication, along with the patient, to the new hospital. As a precaution, the doctors agree to her request, but unexpectedly, in the ward, Mary insists on administering the treatment medication to the patient right away. Upon hearing this, the doctor grabs Mary's hand and tries to escort her out. At that moment, Peter suddenly appears and stops the doctor. It turns out that today at 12 o'clock is the time of his release from prison. Peter explains to the doctor that the reason the striatum couldn't be detected in the boy's kidney biopsy is likely because it was blocked by a large number of necrotic cells. Now, a simple enzyme test can confirm the diagnosis. However, the doctor doesn't want to take responsibility and insists on transferring the patient. Seeing this, Mary quickly grabs the medication, ready to administer it, but the doctor blocks her once again. Luckily, the scarce medication is caught by Peter as he prepares to administer it. "You're not a doctor, are you? Are you practicing medicine illegally?" the doctor questions. Mary is a doctor, right? Peter asks. "Yes, I am," Mary responds, with Peter handing the syringe to Mary. She doesn't hesitate and injects the medication into the patient's body. Afterwards, in order to uncover the truth, the doctor performs an enzyme test on the boy, and indeed, the striatum is found. The boy is finally diagnosed with Fabry's disease. Mary wanted to share this good news with Peter, but Peter leaves without looking back. She chases him all the way out of the hospital, until Peter gets into a car and leaves, unable to catch up with him. Although Peter is gone, his presence inspires Mary to become a true doctor. 2 weeks later, she arrives at a Korean hospital in Seoul, and unexpectedly, she spots a familiar figure. This man is the fastest I've ever seen, renowned in the medical field as the 10-second doctor. But it's not meant to belittle him. It means he can quickly diagnose a patient's condition within 10 seconds just by using his eyes. Fresh out of prison, he is hired as a professor at a top hospital, and the former prison doctor, Mary, becomes his student. At that moment, an ophthalmologist approaches him and informs him that there's a stubborn patient who specifically requested a checkup from Peter, the pain specialist. The patient complains of sudden blurred vision, accompanied by dizziness. However, after Peter examines him, he finds no abnormalities. He knows that this case is not as simple as it seems. So, despite the astonishment of the crowd at the welcome party, he begins to analyze the man's condition. The patient experiences sudden dizziness, diarrhea, and drooping eyelids, but all the test results fall within the normal range. This indicates that the cause of the symptoms is not related to the eyes. He hopes that the doctors present can work together to find the underlying cause, but he is met with rebuke from the head of the surgery department. The head of the surgery department questions why Peter is interfering with another department when the patient is not under his care. He sarcastically asks if Peter wants him to clean up after him as well. Suddenly, Peter receives a notification stating that the man's vision has restored and he will be discharged soon. He rushes to the patient's room immediately and suggests that the man stay for further observation. However, the man insists on leaving because he has an important upcoming competition. Peter directly tells him that his health issues prevent him from participating in the competition. The man seems to be aware of his condition but insists on being discharged to compete. As he descends the stairs, an unexpected incident occurs. He loses control and falls down. After an examination by the attending physician, no major issues are found, only a herniated disc compressing a nerve. A minor surgery can quickly fix the problem. At that moment, Peter arrives again and states that the issue lies elsewhere. He suggests a thorough examination in the neurology department. However, the man firmly refuses because he wants to be discharged as soon as possible. Unfortunately, later in the evening, the man experiences respiratory failure unexpectedly. The attending physicians rush to the scene as the situation becomes urgent, and immediate intubation is required for the patient. However, the responsible attending physician is an ophthalmologist and doesn't have experience with intubation. They begin to pass the responsibility back and forth, suggesting waiting for the arrival of the emergency team. But the patient can't hold on for that long. Just as the situation reaches a critical point, Peter bursts into the room and takes over the intubation procedure. He starts resuscitating the patient without hesitation. One of the attending physicians interrupts, asking Peter if he's willing to take responsibility for what's happening. However, Peter ignores him and continues with the life-saving measures. Soon, the patient's breathing is restored, leaving everyone in the room in shock and disbelief. The next morning, as the intern doctors walk in, they are stunned by what they see. Peter, in his pursuit to analyze the man's condition, had stayed up all night. After a night of research, he suspects that the man may have myasthenia gravis. On the other hand, The attending physician re-examines the patient and discovers that the man has pneumonia, which caused the respiratory failure. Administering antibiotics would allow the removal of the ventilator. Upon seeing the doctor's diagnosis, Peter senses something is amiss. If the man truly has myasthenia gravis, administering antibiotics would worsen the condition. By the time Peter arrives, the man has already developed limb paralysis. The attending physician becomes flustered, suggesting that another examination be conducted for the family members. Peter asserts that the patient can't afford any further delay. Without a confirmed diagnosis, he decides to perform a myasthenia gravis test on the man. If successful, it could save his life. But if it fails, this unconventional treatment could land him back in prison. After obtaining the man's consent, Peter once again risks his own future by injecting the test medication into the man's body. However, unexpectedly, the man's heart instantly stops. Just when everyone believes it's hopeless, the patient regains consciousness. Indeed, Peter's judgment was completely correct. Following Peter's treatment, the man fully recovers and returns to the arena. Not only that, he becomes the champion of KFC and publicly thanks Peter on the internet. As a result, the next day, Peter's pain clinic is inundated with patients. This boy is so pitiful. His ankles are filled with steel nails, his left arm is already fractured, and his right arm is in a splint. Witnessing this heart-wrenching scene, even the doctors were shocked, and while suturing the boy's wounds, Peter chose not to administer anesthesia, because he was certain that the boy suffers from a rare congenital insensitivity to pain. Even if he had appendicitis, he would only notice it when his abdomen rotted. Such cases are almost non-existent worldwide, and there is only one known case in South Korea. Although aware that this condition is incurable, Peter persisted, conducting thermal and pain perception tests on the boy, placing his hand in alternating hot and cold water, and providing repeated cognitive education. Although the brain doesn't receive pain signals, there may still be instinctive reactions at a subconscious level. However, this was merely training his cognitive abilities. But then, the boy felt that something seemed different about his hand. His hand was strange. It felt stiff and rigid. Peter quickly took out a silver needle to test, gently pricking the boy's foot. Surprisingly, the patient with insensitivity to pain showed a response. However, Peter couldn't be happy about it, because it was simply impossible. Peter hurriedly checked the boy's medical records, and right at that moment, something happened to the boy indeed. His foot suddenly started throbbing intensely, and the pain had spread throughout his body. However, upon examination, there was nothing abnormal with his foot, and even painkillers had no effect. As everyone was at a loss, Mary suddenly realized that this could be a symptom caused by hallucinations. But there are over 500 causes of hallucinations, and cases of insensitivity to pain are extremely rare. We can't find anything at all. Peter helplessly turned away. But upon hearing these words, Mary seemed lost in thought, and she immediately caught up with him, sharing her thoughts with Peter. Peter finally found the cause of the illness, but the boy refused to accept treatment, because after treatment, he would no longer have the sense of pain, and he wouldn't feel his mother's warm hand anymore. All of that would be fake. Summer would feel cold, winter would feel hot, the brain would receive many false signals, making you feel even worse. You have no idea what it feels like to not receive any signals. You have no clue about that feeling, and yet you casually suggest that I go back to how things were. Peter remained silent. He got up and led the boy into his research lab, where he showed him a secret meant for adults. Afterward, the boy agreed to undergo treatment, but he had one condition: to taste the flavor of ice cream. The next day, the boy's surgery was successful, and once again, he lost the sense of pain. After the surgery, the boy made a promise to Peter that he would take good care of himself and wait for the professor to cure his illness. On the other side, Mary also wanted to know how Peter convinced the boy with his secret, so she opened his computer, only to discover a shocking truth. Peter himself was a patient with congenital insensitivity to pain. She couldn't believe what she was seeing, and right at that moment, Peter suddenly appeared in front of her. On the bus heading to the hospital, an elderly person suddenly started coughing violently, spraying droplets that instantly spread throughout the bus. At the same time, the radio on the bus was broadcasting the outbreak of a highly contagious Nipah virus in South Korea. Symptoms include high fever, headache, and coughing, with an extremely high fatality rate. Upon seeing this, the passengers started distancing themselves from the elderly person, and they all put on masks. When the elderly person arrived at the hospital, they mentioned having had a headache for the past year. However, when Mary examined their brain scans, no abnormalities were found, so she instructed a nurse to take their temperature first, only to find out that their body temperature was as high as 39.5 degrees Celsius. At that moment, the girl who was also on the bus with her started showing symptoms of high fever. Furthermore, the elderly person mentioned experiencing loss of appetite recently, and they frequently experienced vomiting. All these signs pointed towards the Nipah virus. However, the incubation period for this disease is at least 5 days or more. It couldn't have progressed so quickly. Right at that moment, the elderly person started coughing violently, and before Mary could react, a mouthful of blood sprayed directly onto her face. Finally, everyone realized the severity of the situation. By the time Peter arrived, the doors to the examination room were already locked. The hospital quickly implemented emergency measures, and all the people present were isolated. Mary also put on protective clothing, but she doubted if the elderly person had actually contracted the Nipah virus, so she prepared to examine the elderly person, asking them to lie down on the left side for an X-ray. But the elderly person seemed to have a disorientation problem, walking in the opposite direction. Realizing something was wrong, Mary went over to assist the elderly person, but an unexpected incident occurred. A doctor rushed over upon hearing the commotion, and found Mary unconscious. The elderly person also exhibited symptoms of epilepsy. At that moment, the phone rang, instructing them to administer a sedative to the elderly person. It turned out that Peter had witnessed everything from the monitoring room. Fortunately, the treatment was administered promptly, and the elderly person was temporarily out of danger. However, Mary still hadn't regained consciousness. In a state of urgency, Peter immediately sprinted towards the department. Ignoring the doctor's attempts to stop him, wearing protective clothing, he barged into the isolation area. Luckily, Mary had only suffered a minor impact, and she had already regained consciousness by then. Peter then listed all the symptoms of the elderly person. Realizing that it was highly likely not Nipah virus, he decided to identify the cause before the elderly person's condition worsened. Due to the lack of testing equipment in the department, Peter utilized the power of the team, assigning each person to investigate a specific area of the patient, to find the potential cause that could develop into a systemic disease. After the team's efforts, Peter obtained a crucial clue. The elderly person's weight had rapidly decreased by a staggering 40 kilograms within 6 months. However, mere loss of appetite couldn't account for such a significant weight loss in a short period. Suddenly, the elderly person regained consciousness and revealed the reason, saying they had started taking sleeping pills months ago, which led to the onset of vomiting symptoms. Surprisingly, the elderly person had no history of insomnia. Mary asked why they would do such a thing, and the elderly person realized they had let slip a secret, and fell silent. Peter noticed the hints, and assured her of keeping the secret. Finally, the elderly person revealed the truth. The price of war. I have killed many people. No matter what good deeds I do, no matter how much I repent, I can never repay my sins. At this moment, the elderly person experienced symptoms again. Their hearing seemed to be affected. Blood oxygen saturation and blood pressure were both decreasing, and lymph nodes were swollen. This perplexed everyone, as the patient had developed so many symptoms within a day, and without any warning signs. Peter speculated that it could be a disease with a long incubation period, usually transmitted from abroad. But the elderly person had never traveled outside the country. Suddenly, Mary recalled the mention of war by the elderly person. If the elderly person had participated in a war abroad, there was a high possibility of being infected with a locally prevalent disease, with a long incubation period. Subsequently, based on the elderly person's age, Peter deduced it was the Vietnam War. After a brainstorming session, they finally arrived at a diagnosis: glanders. This disease has an incubation period of up to 63 years, and a mortality rate as high as 40%. Even the occurrence of sepsis does not always reveal the cause. However, they still needed solid evidence to confirm the diagnosis of glanders, which would be the presence of inflammatory symptoms in the body. Peter suddenly remembered the previous hearing loss in the elderly person. Upon examining the ears, inflammation was indeed found. On the other side, the hospital director received a notification from the laboratory department that the elderly person did not have Nipah virus. As a result, the isolation was successfully lifted, and the elderly person was promptly diagnosed. The disease was successfully treated, and the crisis was averted. After the resolution of the crisis, the doctors who had initially tried to stop Peter decided to use his heroic actions for hospital promotion. However, they were unaware of the tremendous risk Peter, who had congenital insensitivity to pain, took when entering the isolation area. Fortunately, Peter underwent a customized examination by Mary, who had shown him great care and affection. Due to the rarity of the symptoms, the boy also appeared on television. Upon hearing the news, those who had previously bullied him approached the boy once again, unhesitatingly resorting to physical violence, even taking out a blade and demanding a demonstration. The boy swiftly knocked away the blade, declaring that he would never engage in such actions again. This infuriated the group, and they violently threw the boy to the ground, inflicting a severe blow to his head. Shortly after, the boy was rushed to the hospital for treatment. Upon learning of the news, Peter quickly arrived at the scene, only to find the boy unconscious, with large bruises on his side, and his arms pierced with nails. After Peter's timely intervention and rescue efforts, the boy's condition stabilized, but he remained unconscious. However, to everyone's surprise, in the evening, Mary discovered that the boy suddenly opened his eyes. Peter immediately examined the boy, and discovered that although he regained consciousness, his entire body was paralyzed, except for his ability to move his eyes. It was a locked-in syndrome. In order to identify the cause of the locked-in syndrome, Peter decided to search for clues in the warehouse where the boy was attacked. Based on the traces of the fight at the scene, he reconstructed the scene of the boy being assaulted. Finally, at the spot where the boy collapsed, he found gasoline mixed with mud. He immediately called Mary. After a comprehensive brain examination, they indeed discovered the abscess that Peter had mentioned. However, due to the dangerous location of the abscess, they needed to contact the neurosurgery department to determine if surgery could be performed to remove it. Mary prepared to inform Peter of the findings, but no matter how many times she tried, she couldn't reach him. Meanwhile, while descending the stairs, Peter suddenly lost control of his body, accompanied by the ringing of his vibrating phone. Peter experienced dizziness and ringing in his ears. Mary also realized something was wrong, and she immediately dialed the emergency hotline. Peter, as predicted by Mary, had indeed lost consciousness in the hallway, with blood flowing uncontrollably. By the time Mary arrived, Peter had already been bandaged up, but due to this incident, the hospital discovered that he had congenital insensitivity to pain, putting him at risk of being dismissed from his position. The next day, the boy's condition suddenly deteriorated, and he fell back into a coma. The neurosurgeon suggested abandoning treatment, as the success rate of surgery was almost zero. At this moment, Peter arrived despite his injuries, and upon confirming that the family had signed the consent form for surgery, he was ready to begin immediately. However, the deputy director walked in, demanding that he cease this futile action. Subsequently, they wheeled the boy to the operating room, but the boy suddenly experienced cardiac failure, and even after medication was administered, there was no improvement. Peter immediately performed cardiopulmonary resuscitation on the boy. No matter how hard he tried to save him, he couldn't revive the boy's life. Helplessly, he caressed the boy's body, shedding bitter tears. This boy, who suffered from the same condition as him, ultimately couldn't withstand the onslaught of the disease. Afterwards, the hospital administration made a decision to dismiss Peter, who had congenital insensitivity to pain. At that moment, patients whom Peter had previously treated came to support him. Although he managed to keep his job as a doctor, Peter's body had already started showing abnormalities. He decided to resign from his position and flew abroad to join a team researching patients with congenital insensitivity to pain, taking on the roles of both a patient and a researcher. At the airport, Peter promised Mary that he would come back alive. Initially, he would send emails to Mary every day, but after a month, there were no more messages in her inbox. In a medical room overseas, Peter's eyes were lifeless, his whole body paralyzed on the bed, as if his life had reached its end. Mary couldn't help but burst into tears. 3 years later, Mary had accepted the reality and emerged from the darkness. She had transitioned from being a medical intern to becoming a professor. At that moment, a figure suddenly appeared behind her.
A closer, a little bit closer. What if I walk to you? Can you hold my hand?